Now, an in-depth look at the news and information shaping our community. This is Moose Talks with your host, Doug Craig, on Moose FM.
Good morning. Welcome to another episode of the show. A little later on, we'll be talking with BC's Minister of Mental Health and Addictions, Sheila Malcolmson, to talk about the Foundry Center coming to Fort St. John, which will offer young people between the ages of 12 and 24 mental health and substance use supports, among other things. But first, a new group in town is formed to help offer support and resources for transgender and LGBTQ persons and their family and friends, called the Trans Alliance Family, Friends, and Youth. Since our interview got cut short last week on the subject, I'm glad to be joined once again by one of the group's founders, Paige Turtell. Paige, thank you once again for joining me.
It's my pleasure, Doug. It's lovely to be back.
All right. Well, tell us a bit about this group. I summed it up quickly kind of at the start there, but can you give a kind of a broader sense of what the group's going to be all about and what your kind of aim with it is?
Well, our aim is to be able to provide resources and outlets and meet and greets and events for trans or LGBTQ youth and friends and family within the Peace area and the Fort St. John community. We have a Discord, and we're also going to be looking at, like I said, events out and among the community.
Okay, so it's not just about here's where you go to find this thing, which is important, but also about let's just come together and talk and be friendly and be social and sort of from that way they learn that you're not alone in things, I guess, eh?
Yeah. It's really important for people to learn that there are other people. Sometimes it can feel really lonely being a trans person or an LGBTQ person, and maybe not a lot of your circle embraces that sort of lifestyle. So knowing that there's a safe place that you can go to just talk to people, like find resources, but also just maybe make friends. For adults to find people who also have children that identify as trans or LGBTQ and just socialize and mingle.
Why now? Why did this group, why did you decide to sort of start this group in the last month or so? Has something happened that you saw kind of a need for this in Fort St. John?
I met up with some people at the Pride Parade, and we kind of got to talking and found that there are a lot of gaps when it comes to resources and knowledge within the area, and we really wanted to step forward. There used to be a group, I believe, in town called PATS, but the facilitator wasn't able to continue for personal reasons. So because it is such an important thing to all of us as board members at A.F.F.Y, we wanted to step forward and make sure that we fill that gap.
We've touched on it, just kind of the social aspect of feeling lonely in that. What other hurdles are LGBTQ and transgendered people facing in Fort St. John that you're hoping to help alleviate with this group, with some of the supports that you're and resources you're hoping to offer?
A lot of gender-confirming gear, so binders, breast forms, and other types of gender-confirming clothing aren't really available within town. I myself had to branch out to Victoria and Prince George, and maybe some other people were in a position where they don't know where to turn. So being able to give that outlet to people is super important.
What about kind of the medical side of things? Is it hard to find resources for that sort of thing too in a town like Fort St. John?
Yeah, very much so. A lot of the doctors out here don't know where to turn or don't know where to begin themselves. My partner is a trans man, and when he first tried to get on testosterone, he was given extremely low doses because the doctor didn't know enough in order to properly facilitate the journey. So we're hoping to be able to connect people with doctors and physicians in general that know a bit more and are more trained, and hopefully in the future maybe help some of the doctors in town connect that same way to get more knowledge.
Do you think you're hoping this also has maybe the added benefit of perhaps raising awareness? I know it's a term thrown around a lot, but is that an aim of this too, or is it more let's just get out there enough that the people who might need our help or are looking for somebody like us, a community, can find it and not you're not so much worried about let's change minds?
A little bit of both,
Yeah.
maybe. Raising awareness is never a bad thing when it comes to this, and just maybe breaking the stigma that some people might have. It's really, really important to us. And I mean, raising awareness is just kind of a byproduct. We hit the ground running, and we've started to connect with some really important groups in town here. Ministry of Children and Families. We've connected with Victim Services and the RCMP. We were actually in touch with the Foundry, so that when they get up and running, we're going to work through them as well. And just really getting out there to make sure that we can be found in as many places as possible.
When you were here last time, I think you said as soon as kind of the word came out that you had kind of formed this group, people were reaching out. Some local other groups were like, hey, we'd love to work with you. It was kind of immediate, wasn't it?
Yeah, we had no idea just how huge of a need there was. We thought there were gaps. But once we started communicating with people and others started reaching out, we noticed that there is a massive outcry of parents and youth that don't know where to turn, and they've been looking for a group just like ours, which just drives our hunger even further to be able to really push. And as we go, finding more and more things that we can offer to the community.
Okay. So I have to ask then, from a community standpoint, me, the medical kind of community in Fort St. John, the governments, the local government bodies, what do we all have to be doing better here? How can we be supporting youth here and LGBTQ youth and transgendered youth and just persons in general that we should be doing more of? What can we be doing?
I mean, that's kind of a tricky topic. I would say just make sure that you're aware of people's pronouns even. That's something that can be super important on such a small level. And I know that for non-LGBTQ or non-trans people, like, you don't even think about it sometimes, but when you're a trans person and somebody misgenders you, sometimes it can be devastating. You can be on such a great day and have woken up in a great mood, and that one small thing can really bring you down quite far. So just be aware, maybe ask people. Also just be supportive, because everybody's got their own journey. Everybody has their own lifestyles and their own things that they're dealing with. And it's really good to be supportive of people, because you don't know what they deal with. You don't know where they're from, what they've been through.
Youth, again, part of the acronym of the name. Is there been any talk about getting into the school district, maybe, talking to children specifically, again, looking for people who need your help directly, but also sort of the raising awareness, the ending the stigma side of things too?
Absolutely. We were already in touch with the high school and some of the middle schools about putting up posters for our event, and we're also going to be in contact with the school board pretty quick here to discuss potentially having presentations at the schools to just, again, bring awareness to the group in general.
Wonderful. All right. Well, in the immediate future, your kind of first event is coming up in early July. Tell us a bit about that and when it's happening and how people can get involved.
It's at the Click Building in Fort St. John. Again, I don't have the address offhand.
It's just down 100th Street there.
Yeah. It's July 9th, and it's going to be from 11 a.m. to 3 p.m. And we're also going to have food that's been provided. A huge thank you to Cobb's Bakery, Cass's Kitchen, Anila's Kitchen, the local Butcher Block, Amanda's No Frills, and the Fort St. John Save on Foods. They've all kind of helped us out with providing food and snacks and sort of amenities for the event.
I didn't ask you this that last time. I wonder, how does it make you feel to see companies, local kind of organizations and businesses stepping up to say, hey, we want to help you out with this in some way?
It melts my heart, honestly, seeing that there are that many people who are willing to put a little bit of themselves on the line and their business on the line to help out. I mean, we're just getting started, so we don't exactly have a huge amount of funding.
Yeah.
We do work closely with the Pride Society in town, but we didn't want to just always ask them for funding immediately.
Yeah.
We want to be able to have a good working relationship. So we wanted to find other ways to kind of fill those sorts of things. And honestly, I couldn't believe just how many people were willing to help. It's amazing.
Wonderful. All right. And finally, I've blanked on where I want to go. Oh, yes. Someone's listening right now. They're transgendered or LGBTQ looking for resources. It's a family member, a friend. They want to get in touch with you and maybe start the process. What's the best way to get a hold of you and Taffy at the moment?
Aside from seeing our posters all over town, you can contact the Friendship Center, or you can contact the Victim Services or MCFD. We're also going to be in touch with the Women's Resource Center, and just we're really trying to get our name out there. So there are lots of places, and the list is just going to continue to grow. We have a Discord channel. We're working on getting a phone line as well, and a Facebook group, so that we can have more ways for people to contact us.
Okay, and what's the name of the Discord channel?
It's Taffy.
Taffy,
yeah.
okay.
The link, I believe, is on all our posters.
Okay.
And we constantly refresh that to make sure that it's easy to access.
Excellent. All right. Well, Paige, I really appreciate you coming by and for a second time to make sure we got this interview done right. Thank you so much for being here.
Thank you very much for having me.
You're very welcome. That's Paige Turtell with the Trans Alliance Family, Friends, and Youth Group here in Fort St. John. We'll be chatting with Minister of Mental Health and Addictions, Sheila Malcolmson, right after this on Moose Talks. Welcome back to Moose Talks. I'm Dub Craig. Now, you may have heard the news last week that a Foundry is coming to Fort St. John. The mayor was at the announcement. This Minister of Mental Health and Addictions, Sheila Malcolmson, was also there. It sounds like the Fort St. John Friendship Society is going to be running it. And it's going to be designed to be a place for young people between 12 and 24 to access mental health and substance use supports. So to talk a bit about what that means and kind of what's next on the road to making it happen, I sat down with BC's Minister of Mental Health and Addictions, Sheila Malcolmson, a little earlier on to chat with about that. Here's that interview. Sheila Malcolmson, the BC Minister of Mental Health and Addictions, joining me on Moose Talks. How are you doing today, Sheila?
Thanks for the invitation.
You're very welcome. So you helped announce that a Foundry is coming to Fort St. John. We don't have a date on any of that yet, but the announcement nonetheless kind of last week. Tell us a bit about what a Foundry is exactly.
I've had the real pleasure of being able to walk into a number of Foundry centers across British Columbia, and this is what it feels like for young people, ages 12 to 24, who are looking for primary care, maybe sexual or reproductive health needs, mental health counseling, addiction support, substance use challenges, or just a friendly place to hang out that is trauma-informed and culturally sensitive and very gender aware. Young people walk into a center, they're greeted by peers, people that have lived experience and are their own age. They're met with respect and dignity in a really colorful, beautifully designed setting. And walking through a Foundry Center, you'll encounter a registered nurse, clinical counselors, places for group therapy kind of conversations, just breakout spaces for young people to talk and share stories and support each other, rec room, spaces for cooking. A lot of the programming is done around food. And every community does look a little bit different. And so Fort St. John's Foundry will be shaped by the youth and by the Friendship Center, the service provider that's been chosen. But it's such a respectful and youth-oriented, designed by and for youth. And the people that I talk with that have received services at Foundry just describe it as life-changing.
Wow, that's incredible. The collaborative, it sounds like it's very collaborative, as you said. So when the government announces something like this, is there a dollar value really attached to it? Or is it, we're going to support you in making this happen, depending on kind of what your needs are? And we're anticipating what some of them are, but you're going to help us decide what they are.
Yeah, well, It's a pretty competitive process to choose a foundry. In my own community in Nanaimo, where I represent as a MLA, several years ago, along with Kamloops and Fort St. John, Nanaimo, a whole bunch of communities, they got the opening kind of invitation to put in an application for Foundry. They design, kind of describe their own pitch about what community needs are and how many social service organizations are willing to partner on it. And then the process that the experts at Foundry, based on their own peer advisory panel and their experience in standing up other foundries in other parts of the province, that really, informs both the selection. And then, like with the announcement last week, good to say, yes, Foundry has been chosen. Now it's time for the partners to come together to coalesce around the Friendship Center, which is the lead. And then they work together to identify the space, to choose the spot, and then to start to design kind of the entry points. Fort St. John is an exceptionally young community. The average age is 31 and a half years old. I mean, I don't know that demographic in any other part of the province. So I imagine that this foundry will look different from, say, the Surrey foundry, which might have more cultural inputs. So what we do provincially, we fund through Foundry the startup costs, some of the operating costs, significant part of the operating costs, but there certainly is a responsibility and obligation on the community to also do fundraising. And that's part of the selection process as well. How much community push and support is behind it. To have the mayor, Laurie Ackerman, just be such an incredibly dynamic and very compelling partner and validator and advocate for Foundry is an example of demonstrating that community support. So all of those pieces come together.
I see. You mentioned the demographic being probably among the youngest in the province. Was that the sole reason that it was invited to, or Fort St. John was invited for this project, or were there other factors that came into play that you came aware of, or how did the situation work? I guess my question is, how did you come to the decision to bring this to Fort St. John?
Yeah. What we did on the provincial side, recognizing as we're building up a system of care in all kinds of areas, there wasn't a system of care in place in British Columbia when we first took government in 2017. And so we've been working over time to design a plan, which we call Pathway to Hope, to open up new substance use treatment beds. We're doubling them across the province. We've added mental health counseling. We're funding expanding eating disorder support. We just heard last week in Prince George, they've got now triple the capacity to help young people who are struggling with eating disorders. So across the spectrum, there's lots of budget decisions and priorities that the government's making. But Foundry's a little bit different in that we knew this is a really good model. We want to fund the model, but there isn't a political filter that decides this is the community this is going to go to. Because me as minister, I want the people that are most on the front line and have the most experience to make that decision. So the kind of criteria are the capacity that the community shows through their application, their history of already working together, social service organizations that have a really good model already of cooperation, definitely community need. And we know that in the North in particular, it's hard to both recruit and retain healthcare staff. And I talked to people in Fort St. John last week working for the health authority who are putting heart and soul into the work within our emergency rooms and youth treatment centers, but staffing is a challenge. And so there's an example of there are gaps, notwithstanding the work that we're doing to add through health authorities unprecedented spending to support young people struggling with mental health and addiction challenges. There are still gaps. And so the Foundry model is a really good way to create that navigation center, to provide an extra oomph of support. And so Fort St. John pushed through both by the data showing us that there's a need, that there are young people not being connected with support, that there are a ton of young people, and that there were very willing and cooperative partners that made a compelling pitch. So Fort St. John is the first of 4 new foundries that we'll be announcing. The other 3 haven't yet been announced. But this was the first piece of good news, and Fort St. John was out in front.
Now, again, as I said kind of at the top, there's no specific date really for anything yet. So I just wonder if you or the other people involved kind of have a timeline for certain things that are going to happen. Is it set out that people have to report back with this information then? And are we talking months or years in terms of maybe having this open up here?
Yeah. So right now, all this summer, we're going to have a whole series of new foundries opening, ones that we funded several years ago, and their communities have been working hard to get centers open. And so on average, what it's been taking from an announcement date to actually get in service has been 2 years. That's longer than it used to be, and COVID had a lot to do with that, people's ability to get together and work together, but also global supply chain interruptions we've heard from the foundry operators have been a real challenge. So I would say for Fort St. John, the outside might be 2 years, but we know the community is really motivated. Probably one of the very first steps is finding a willing landlord or an existing building or facility that could be renovated. And depending how quickly the community is able to come together and pitch in on that, and I really hope that we'll be able to do that faster. And I really look forward to being there to be part of the opening celebration, having seen the just incredible community support at the announcement of A.F.F.Y first coming. But I know that the community is super motivated, and I know that that both the folks at Foundry and also the Friendship Center, Indigenous Friendship Center, is going to be really good at keeping the community up to date. And in the meantime, remember that as long as you've got internet access or a telephone line, Foundry Virtual is working really well to connect young people with counseling and helping them navigate towards other primary care supports. So that's Foundry BC. It's an app that we designed and released last year, designed for and by youth. And so fantastic if young people in Fort St. John right now start getting themselves familiar with the kind of services that Foundry will have physically for them by starting to tap into some of the counseling and supports and really life-saving work that Foundry does in a virtual format for people across BC.
Mm-hmm. I want to ask quickly too, there's lots of mental health and sort of supports that are part of this that are important. Overdose prevention and overdose prevention sites, why isn't this a part of this somehow? Is that just a separate thing altogether? Was there thought given to that being a part of this whole kind of big announcement of Foundry coming here?
We have, since our government formed, gone from one overdose prevention site to 40. A good proportion of those right now are inhalation overdose prevention sites, which has been really important as part of our adaptation, how our response to the overdose crisis has evolved, and as people's ways of using these illicit street drugs evolves also. But there hasn't been any model where any of the foundries so far have co-located supervised consumption and a foundry center. And that's partly because we've got young people as young as 12 using Foundry, and we would much rather have the health authority and community service organizations site appropriately supervised consumption sites. Now, certainly Foundry would be in a position for older youth to orient them towards tools to, if they are challenged by substance use and are at risk of overdose, certainly navigating them towards the supports that are available. And there certainly are harm reduction materials that are available at Foundry centers. But we know we funded the health authority to open a supervised consumption site in Fort St. John. We know that's been a real challenge, partly because of the city bylaws, which greatly limit the health authority's ability to move. And that is a problem for us to solve together, but not using the Foundry model.
So final question, quick. You touched on this already. What's sort of next then? What's the immediate thing that has to happen next for the Foundry? I think you said a landlord has to be found who's going to donate or give the space for it, right?
That's right. Yeah. So now that it's officially known that the Foundry will be coming to Fort St. John, now the lead organizations, the health authority, their other partners can start to do that public work of saying, look, we're looking to lease the space. Or are there city facilities that we can use? Are there ways that the health authority can share space in other ways? Now it's public. We really put it to the communities to lead because every community is different. Every place has got different, contractors, people that are willing to donate labor. We know that there's just so much building, so much economic activity that sometimes just getting the folks to do the building work can be a challenge. And so that's part of the scheduling work that will happen now. But bottom line is everybody is feeling the urgency of the need to connect more people with both mental health and substance use supports, let alone primary care, counseling, peer connection. This has been such a really challenging period of time for youth where they've been much more isolated than anybody should growing up. And so everyone feels the urgency, the need to get the space, to get the program set up. We just opened a Foundry Center 3 weeks ago in Comox Valley, and they really built that place as quickly as they could given the pandemic. And we're really hopeful that this will, the Fort St. John's will come together faster. But being in that pavilion announcing that we are bringing Foundry, how many people were in the space, a lot of tears shed, a lot of tears of joy and relief. And that just gives me a sense that Fort St. John's going to move as fast forward as they can. And we as the provincial government will be there to support them. Congratulations to Fort St. John for securing the Foundry. And I know it's really going to make the difference in the lives of young people.
Excellent. Well, Minister, I really appreciate you taking some time to chat with us about this today.
Well, thanks so much for the interest, and I look forward to talking again.
That was Minister of Mental Health and Addictions, Sheila Malcolmson, joining us from Nanaimo earlier on today. Not sure why my voice had a strange effect on it, but anyway, we'll move on and upward.